Welcome to TSD Broadcast, the platform where we think, speak, and discuss. My name is Nyasha Sharon. In today's broadcast, we're going to be discussing the burden of cancer in Zimbabwe. This broadcast comes soon after we buried my father, who succumbed to cancer of the esophagus on the 8th of September 2020. May his soul rest in peace. And so before we delve into our discussion, I'm going to share a few facts about cancer as published by the World Health Organization. So they say cancer is the second leading cause of death globally and is responsible for an estimated 9.6 million deaths in 2018. Globally, about 1 in 6 deaths is due to cancer. Further, about 70% of deaths from cancer occur in low to middle income countries. Also, cancer-causing infections such as hepatitis and human papillomavirus are responsible for up to 25% of cancer cases in low and middle income countries. Unfortunately, late-stage presentation and inaccessible diagnosis and treatments are common in low to middle income countries. And in 2017, only 26% of low-income countries reported having pathology services generally available in the public sector. This is opposed to 90% of high-income countries where reported treatment services are available. And only 1 in 5 low and middle-income countries have the necessary data to drive cancer policy. And so we go back to our topic with specific focus on Zimbabwe. And so I'm going to discuss five issues. And in this particular broadcast, we'll probably concentrate on just 2. So the 5 issues are: 1, the issue of cancer registrations. 2, we're going to discuss the national cancer policy in the country. 3, we're going to discuss the availability of infrastructure for treatment and management of cancer. 4, we're going to discuss the treatment costs as well as management costs of cancer. And 5, we'll discuss palliative care. And so back to the first issue, that is the issue of national registration of cancer statistics. What happens in Zimbabwe, being an African country, you find that when somebody becomes sick, rushing to hospital or to seek medical treatment is not the first port of call. People normally decide to just watch. And being a generally religious country, people decide to either go to church, go to the pastor, get prayers. The prophetic churches, they go to the prophets, they get prayed for, they get holy water. And for those that believe in African traditional healing, they go to the traditional healer and they get the various herbs for them to manage whatever disease that they have. And so usually it is only when the disease becomes unbearable, when they realize that there is no help in these other options, that people then decide to go to and seek medical treatment. But usually at this stage, it is too late. So sometimes when they go to the hospitals, then they're told the disease is advanced, and so they decide to just go back home and just watch and wait for their death. So in that case, the cancer is not registered at all in any of the national systems. 2, sometimes when they go to the hospital and they're told the cost for consultation, the cost for diagnostic and testing, the costs are just beyond the reach of many. So what happens? People just go back home and just watch and wait. So again, the disease is not registered in the national systems. We have the National Cancer Registry, which is based at Mpilo Hospital in Bulawayo, as well as Parinyatwa Hospital in Harare. And these are the 2 major public referral hospitals. And so the purpose of the National Cancer Registry is to collect data of cancer in the country. And this data is collected in various ways. It's collected from records of hospital visits, be it at Mpilo Hospital, at Parinyatwa Hospital, as well as other private hospitals such as Mater Dei in Bulawayo and Avenues and Western hospitals in Harare. And then other ways of collecting the data also include visiting the diagnostic facilities. And this is to collect data for histology, for blood tests that were presented for testing. And then also data is collected from the registry of deaths. And so from death certificates indicating cause of death as cancer, then that is how data is collected and recorded. So you find there deficiencies in these methods, because sometimes patients do not present, and so they're not tested for cancer. And sometimes when deaths are reported, the person will not have been treated for cancer, and so really cause of death is not recorded as cancer, because if a patient cannot afford, if the family cannot afford to have them go for treatment, there's very little hope that they will be able to afford to request a post-mortem after death. And so you find these deficiencies in collecting of data. Indeed, it is very critical, it is very crucial that we have the necessary data so that we're able to as policymakers, and even for the researchers, cancer researchers, we're able to coordinate efforts and see which types of cancer are prevalent in Zimbabwe, and see which types of cancers needs urgent attention, needs more allocation of resources to be able to assist in management, in treatment and management. And when you look at the National Cancer Registry, you can also see that they're underfunded. You can see that they're underfunded. As we speak, the most recent data on cancer statistics in Zimbabwe at the National Cancer Registry is as at 2015, and this is 2020 as we speak. So you find the annual report on cancer was published in 2017, and it is a 2015 report. And so all the information that has been collected is just 5 years. It's 5 years before today, and so it's not as up to date as we would expect, and it's not very helpful, in then trying to manage and track the rate of growth and new infections in cancer. Then secondly, I'll move on to the National Cancer Policy. In 2014, the Ministry of Health published a document called the National Cancer Prevention and Control Strategy. And this document was for the period 2014 to 2018. So this document, when you look at it, it's a very good document. It's well thought out, and the strategic framework really is very clear. It's very clear, very commendable. Unfortunately, in terms of implementation, it's very pathetic. You find that many of the goals, the targets in this particular document were for 100% completion, implementation by 2018. But as we speak in 2020, just a lot of these things remain at 0% implementation. I'll just speak to a few things. For instance, the strategy was to advocate and for communication and resource mobilization, so that a percentage of the health budget was specifically allocated to cancer prevention and control by 2015. But as we speak in 2020, none of that is in place. In fact, one female legislator a few years ago advocated for the implementation of a cancer levy in Parliament. And this proposal really did not gain any mileage, whether it's because that particular legislator was a survivor of breast cancer, and probably because the majority of parliamentarians are male, so they probably felt that this was not a priority, because they just looked at breast cancer and did not appreciate the incidences of cancer in the country. So this just did not gain any mileage. And to date, we don't have a cancer levy in the country. We don't have any specific budget towards cancer prevention and control in the country. When you just look at this document, really, my heart bleeds. My heart bleeds. It says the mission is to increase the awareness on all cancer-related issues and create an enabling environment for adoption and practice of evidence-based cancer prevention, early detection, diagnosis, treatment, palliative care, rehabilitation, surveillance, and research. I know it's all well-sounding, all high-sounding, but in terms of implementation, it's sad. The overall goal was to reduce cancer morbidity and mortality, and to improve the quality of life of people living with cancer and their families by 2018. But as we speak, we don't really see much of that on the ground. We don't see much of that on the ground. we are aware when we are affected, when our families are affected, that's when we are aware of the significance of cancer in the country. It has been, I think in 2018, the World Health Organization forecast that by 2030, 80% of new cancer infections in low to middle income countries would be in Africa. And we had so much time to prepare. But right now we're just 10 years shy of reaching 2030, and we are just so ill prepared. We are so ill prepared. You know, when you're speaking in groups with people, when you're just speaking in social circles, people look at cancer and they really do not understand it, you know. You find people saying when people stress too much, they have cancer. People who have cancer, people who just stress too much, you know. Or they say, oh, it's just a family history of cancer, and so this is why this particular person has cancer and things like that. But the truth of the matter is that the majority of cancers in Zimbabwe, or the top 5 cancers in Zimbabwe, are caused by infections. Many of them are caused by infections, and these infections include hepatitis B and C. This causes liver cancer. There's the human papillomavirus. This causes cervical cancer. There's the Helicobacter pylori bacteria. This causes cancer of the stomach, cancer of the esophagus. And so you look at these conditions, these risk factors. This could easily be managed at early stage. This could easily be prevented. You know, people could get the necessary antibiotics. You know, we talk about, oh, this person is acids, you know. Many of us have a relative or friend that we know that is acids, but that is one of the manifestations, you know, of the risk that then leads to these cancers of the stomach and cancer of the esophagus, you know. So if we're able to then control the acids, if the primary health care is able to ensure that these acids are controlled, you know, you then are able to stop the cancer from growing in its early stages. When you're looking at cervical cancer, you know, if there was an early screening process, one would then be able to have any precancerous lesions that are identified at that stage to be managed so that they do not then progress into full-blown cancer. And so we need these training programs, we need awareness programs, we need collaboration among stakeholders, not just the health professions, not just the political authorities, and not just the patient, but a holistic approach, right from grassroots level. Let children be educated. Let children be educated about cancer. Right now we have a high incidence of childhood cancers, and this is a growing threat that we're not taking, sitting up and taking full notice. And yet this is something that is quite specific to sub-Saharan Africa. And as a people, we should be sitting up and wondering and worrying why the sudden rise in these childhood cancers, the retinoblastoma kind of cancers. And so we just need to take note. We need to discuss amongst ourselves. We need to think. We need to speak about these things. That is the only way that we can increase awareness. And that is the only way that we can make sure that the right steps are taken and the right people get together, and that we all combine efforts to make sure that cancer does not continue to grow unwarranted in this country. And so I ask you to like, to share, and to subscribe to this channel. And until then, think, speak, and discuss. Cheers.